Hi, my name is Ann Watson. I work for the Angelina County and Cities Health District in Lufkin. I'm a registered nurse there and a public health nurse educator. I want to first of all talk to you about your treatment plan. A lot of people don't really realize that they have a treatment plan, but it really involves three things. It involves your diet, your exercise, and your medication. And when you think about that treatment plan, really two of those three items is involving you and you alone. You're responsible for the food that you're eating, you're responsible for the amount of exercise that you're getting, and you're the one that's trying to take care of all of that and then go to your doctor and get your medication. It's very, very important that you keep a journal. I feel like every day that you would come in and when you get your blood sugar first thing in the morning, that you would record that in your journal. You would also record like the amount of carbs that you're eating that day or the amount of exercise that you're getting. So that when you do go to the doctor, if you're doing everything on your part, if you're doing the right amount of exercise, the right amount of food, and the right amount of specific food like the carb counts, then you can talk with your doctor about possibly if your blood sugar is not going down, maybe he needs to look at your medication and he might need to control your medication better. And when you have this journal and you're visiting with your doctor, it's going to give you more freedom to really understand and the doctor to understand that you're really doing everything that you can to possibly control your diabetes. Your daily blood sugar that you do every single day, that's something that you're going to get up first thing in the morning and you're going to get a fasting blood sugar every single morning. As soon as you get out of bed, more than likely you're probably going to go to the restroom, then you're going to probably go into the kitchen and start making coffee. And at that point in time where you're waiting on your coffee to be made, that's the ideal time for you to do a fasting blood sugar. You're going to go through doing that. Your fasting blood sugar should be somewhere between 70 and 130. And then some doctors will also have you do a 2-hour postprandial blood sugar, and that would be 2 hours after maybe you've eaten breakfast. So let's just say you finish breakfast at 7:30, then at 9:30 you're going to go ahead and do that 2-hour postprandial that he wants you to do. And at that point in time, your blood sugar should be less than 180. It's very, very important that as a diabetic that you have the right information and the right devices that you need to take your blood sugar. So one of the first things that you're going to do after you're diagnosed with diabetes is you're going to go and buy a glucometer. A glucometer is something that it's where you stick your finger and then you get those readings every single day or every time that the doctor has you do your readings. Sometimes a person can take a reading once a day, and there's sometimes that diabetics are so severe that they have to take their readings more than once a day. They may take them even up to 3 or 4, 5 times a day. When you purchase the glucometer, of course you want to be aware of what the price is going to be, but sometimes the glucometers are not very expensive, but when you start buying those strips that have to match up with this specific glucometer, these little strips like this is 50 in this particular bottle. Sometimes the strips are very, very, very expensive. And the strips and the glucometer have to match. You can't just buy random strips to match any glucometer. They have to match. So when you're buying that glucometer, be sure that you're not only looking at the price of the glucometer, but that you're also looking at the price of the strips. We don't want anyone to get into problem with not being able to afford the strips. Some of the glucometers that you can get will actually talk to you. So if you have trouble hearing or you have trouble with sight, it might be that you're going to want one that's going to have big numbers where you can actually see them, or it might be that you need, if you do have trouble with your sight, it might be that you want to have one that actually talks to you. When you also buy your diabetic supplies, you're going to have to buy some lancets. These are little small little things that stick you, get your blood drawn. And these little lancets have to be used. There's a new lancet that has to be used every single time that you're sticking yourself. So when you're discarding these lancets every time, you need to be sure that you're disposing of them in a Sharps container, which you can purchase at any drugstore, Walmart, or online at Amazon. Or if you don't want to go to the expense of purchasing a container, you can also just use like a liter bottle of Coca-Cola that's been emptied, or a large Tide bottle. Any of those containers that are heavy plastic that you can use, and you can put your Sharps in those every single time to discard them. And at the end of the time when that bottle is full, you'll just tape up the top and you'll put a medical waste piece of tape on the front of it, and you can just drop that in your garbage that goes out on your daily trash. So when you start using the glucometer, one of the things I want to go through and show you just a little bit of some of the things that you can do with your glucometer is the first thing you do. I like this one because it fits in the palm of my hand really nice, but you're going to turn on that glucometer.
Your meter is on. Please wait.
It's telling me that the meter is on to please wait. It's telling me to enter the test strip. So I can put this test strip down in here.
Please apply blood into the test strip.
Please apply blood into the test strip. At that point in time, I would use this little lancing device. And at this point in time, this little strip, or this little lancing device actually, is one where this top just unscrews and comes off. And then you would put your lancet in there, you would push it down, and then you would turn and take the top off. Then you would put this little top back on, and it wants to click when it clicks. And so there, at that point in time, it is loaded. And then you would be ready to stick your finger. When you stick your fingers, it's important that you rotate your fingers. That's very important because if you stick the same finger over and over, it's going to get really sore. So I would suggest that you stick on the side. You want to stick on the side of your finger, not in the middle. It's a lot less painful, but stick on the side of your fingers, and you can use like your index, your middle, and your ring finger on both hands. And then you can also use like the other side. You can come back and use the other side of those fingers. So if you did that, you would have 6 sticks on this hand and 6 sticks on this hand, and it will keep your fingers from getting so sore. When you use your lancing device, you're going to just stick on the side of your finger, and this is already loaded. So I'm not going to actually stick my finger today because I have to say that I'm a hard stick, and a lot of times I don't get blood real easy. Sometimes if you don't get blood real easy, you can also warm up your hand before you stick, and then you can also shake your fingers, and that helps the blood supply to come down where you will get a better stick. Also, on this little lancing device, you have some little numbers up here at the top, anywhere from 2 to 10. I would tell you that probably to use the 8, 9, or 10 settings, because those are higher settings that give you a little harder stick if you have callous fingers. So you would just take your lancet device and you would just put it here on the side of your finger, and then you would push this little button right here on the side that actually would do the stick for you. And then once you do that stick, you can come back and you can kind of squeeze up your finger. And then at that point in time, you're going to get a blood drop there. And when you get a blood drop there, then you're going to bring your meter up, and you're actually going to put that little blood drop on the end of your little strip. And at that point in time, your meter is going to start counting down, and shortly after that, you will get a reading on your glucometer every time that you do that stick like that. So if you have any questions with that, you can always call me at the Health District. I can go over that with you. My number at the Health District is 936-633-0629. I'd be glad to help you at any time. At this time, I'd like to introduce a friend of mine. Her name is Carol, and Carol has a specific device which I'm very impressed with. Come on up, Carol. Carol has a continuous glucose monitor. Instead of having to stick her finger every single day, maybe even numerous times a day. Carol, would you show us what you have on your arm? Carol has the continuous glucose monitor. And how often do you put that on?
Every 14 days.
Every 14 days. And how much does this cost you about per month?
$75.
$75.
Yes, ma'am.
And so you're not buying strips, you're not having to buy a glucometer.
No.
And then how does it work on your phone? Tell us about that.
Okay. You have to bring it up on your phone.
You have an app that you download?
Right. And then you press this. And when you first put this on, it'll read here, and you put your phone over here and did it.
Okay. And you get your reading.
You get your reading on that. Well, it takes an hour for it to come up.
After you first download it?
Right. When you first download it and you're doing that, it'll go off. It'll come up with instructions on here how to do it.
Okay.
And then you put your phone there, and when it connects with it, it'll let you know. And then it'll take an hour for this to set up.
Okay.
And then after that, when it sets up, it works.
Okay. So how many readings were you doing? How many times were you sticking yourself every day?
When I started out once a day, then it was to 2.
Okay. And so now, how often do you check your reading when you've got this that you can just glance at?
I check it 5 or 6, 10 times a day.
Okay, and has it caused your readings to go down for you to have better control of your
Yes,
diabetes?
Yes, it has.
Okay. Any other thing that you would like to tell the folks that are listening?
No, not that I know of. I just enjoy this, and it's so much better than having to prick my finger.
Okay.
That's,
Thank you,
and,
Carol.
you're welcome.
We hope that you've learned something today from this video. We hope that it's given you some information that you can at least call us for more information. We'd love to talk with you. We have diabetic classes that we offer here at the Health District. We offer those 4 to 6 times yearly. We have them in English and Spanish. So I hope this has been a good video for you to watch and that it's been very productive for you. Thank you so much for watching.